How do tumor-treating fields target microtubules in brain tumors? Imagine a gentle but persistent electrical force that can interfere with how cancer cells divide. That's essentially what tumor-treating fields do in brain tumors. They use low-intensity, intermediate-frequency alternating electric fields, usually around 100 to 300,000 cycles per second, delivered through special devices placed on the scalp. These fields are non-invasive and target the tumor directly. The main way they work is by disrupting microtubules, which are tiny tube-like structures inside cells. Microtubules are made from tubulin proteins that come together to form the mitotic spindle. This spindle is crucial for pulling chromosomes apart during cell division. When tumor-treating fields are applied, they interfere with the assembly of these microtubules by affecting the tubulin subunits. This disruption prevents the proper formation of the mitotic spindle during metaphase, causing the cell to get stuck in division or produce abnormal daughter cells. This process ultimately leads to cell death or dysfunctional cells that can no longer grow. In addition to stopping microtubule assembly, these electric fields disturb the structure and function of the mitotic spindle itself. They also interfere with proteins like septins that are essential for cytokinesis, which is the final step of cell division where one cell splits into two. During telophase, the electric fields create forces that move cellular components through a process called dielectrophoresis, further hampering the cell's ability to successfully divide. Because rapidly dividing cells, like those in brain tumors such as glioblastoma, are actively going through mitosis, tumor-treating fields tend to target these cells more than normal brain cells, which divide less frequently. This selective targeting helps minimize damage to healthy tissue. Beyond disrupting cell division, tumor-treating fields can also stress tumor cells in other ways. They can trigger stress responses like endoplasmic reticulum stress and autophagy, which can lead to programmed cell death or apoptosis. They may also change how the cell membrane behaves and influence the blood-brain barrier, potentially making it easier for drugs to reach the tumor. Clinically, tumor-treating fields are approved by health authorities like the Food and Drug Administration for use alongside standard treatments such as chemotherapy and radiotherapy. The therapy is painless, non-invasive, and can be used continuously for many hours each day, often over several months. It is considered a safe addition to existing treatment plans, helping to improve outcomes for patients with brain tumors. In summary, tumor-treating fields target microtubules by applying alternating electric fields that disrupt tubulin polymerization and mitotic spindle formation. This interference causes errors in cell division, leading to the death of tumor cells. This innovative approach offers a non-invasive way to complement traditional treatments and is supported by extensive research and clinical use. Always remember, if you or someone you know is considering this therapy, it's important to consult with healthcare professionals to understand the best options for individual cases.